So the inspiration for our Women's Heart Community event comes from the fact that we as women need to understand that heart disease is a problem for us as well. And that's not something that's well known. And coming to the organization, seeing how we care for the community, there's one thing that we could bring to specific population, the women in our community, to make sure that we're educating, screening, and helping them find ways to just live a healthier life.
I think heart disease is often under-recognized and undertreated in women, and there's a lot of power in prevention, whether you're at the beginning of your life or you're a little bit older. And if you have disease present, we can prevent that disease from becoming worse. And if you are young and don't have that disease present yet, we can prevent that disease from becoming an issue for you later in life.
We want women to feel empowered when they come through the door, just by looking at other women that are going to be in the room with them, and just hearing the panels, mostly females. We do have male counterpart there, but just hearing those words from cardiologists, from pharmacists, from psychologists, just telling women what is in your reach, what can you do, how can you influence. And one of the biggest things is when you walk through this door to be empowered, we're not asking you to take 5 things. Like, just come in with the notion that you're going to learn 1 or 2 things that you're going to implement to change the outcome of how you live 10 or 15 years from now.
I think we as women are often last on our own to-do list, and I think this is a great opportunity to put ourselves first and empower ourselves to learn about how to better take care of ourselves from a cardiovascular perspective so that we can better care for ourselves and for our family members and community.
Some of our partners and other physicians are going to be talking about the Well Woman Visit. What does that look like? How can you take a day out of the year and take care of yourself? Does cardiovascular disease or heart disease really impact the stress level you have, or the things around you that's impacting you? Does it affect your heart, as well as high blood pressure?
I think there's going to be so many amazing topics. You're going to have so much to take away. But what I'm going to be specifically focusing on is a healthy lifestyle. We talk about this because it's a backbone of every form of prevention. But we're going to be talking about nutrition and exercise and the impact it has on your overall cardiovascular health. So it should be a really great lecture series.
That's just the morning. It is just the morning, because we talk about what that pathway looks like in the afternoon, where people get to not only see what we're doing in terms of the activities of what exercises and diet, but they get to choose that. They get to go and get screened if they've never gotten screened before with their blood pressure. But most importantly, we're going to be talking about what does it look like to have what's something called coronary calcium scoring. So you want to talk to them about that as well?
Oh yeah. So the calcium score is like our new screening test for heart artery disease. So it's like the mammogram for breast cancer screening, the colonoscopy for colon cancer screening. We now have a heart artery screening test called the calcium score. And it is meant for the asymptomatic patient to kind of figure out, do I have coronary calcium present? And if I do, how bad is it? Where am I in comparison to my peers? And it helps risk stratify you for cardiovascular events later in life. So it's a new screening test and something that we're really excited to offer to patients.
Mm. And the one thing about that, though, where the inspiration comes from, with not only hearing the physicians talk, but being there in the afternoon and talking to the people who actually perform these tests and actually answering the questions while you're there to see if you qualify to get this test. Because not everybody qualifies for the test, because you have to be in a certain age bracket. You have to have certain risk factors, so you qualify for the test. And the great news is you can actually schedule a test while you're there. So that's really going to be something that, if people who have heart disease and running in our family, and they know they have high blood pressure and they're over the age of 45, that's something you want to consider as a female.
And if you have a primary care provider and you're worried about some of the stuff we talked about, and you're afraid that you may have risk factors for cardiovascular disease, such as diabetes, high blood pressure, high cholesterol, and you want to be seen by a cardiologist, these lectures are meant to empower you to go back to your primary care provider and talk to them about maybe being referred to a cardiologist and see if you need follow-up with us.
So for all of those who don't have primary
Yeah.
care providers, like Dr. Pimpleton said, let us know while you're there, or come in if you're not able to get into the morning session, because I know seats will be limited because of the room spacing. But come in the afternoon, register for the afternoon. That's limitless, and you can talk to us about connecting yourself to getting the primary care. Talk to us about getting your blood pressure checked and getting active with everybody that's going to be doing, and meet people. You know.
After our lectures, we will be sticking around. Many of our heart care providers will be sticking around, and many members of our team will be around. And we're excited to interact with you and get to know you and kind of help you through, navigate the afternoon sessions and point you in the right direction. So yes, we're really excited to get to know you guys.
Come to be empowered, and they're being inspired. And just know that one of the reasons why we do this with our motto, with saving the lives of women through education, and that's what we really want to do by empowering you to know what your heart health is.